Welcome back to The New Health. Again, with me today, I have Dr. Cheng Ruan from the Texas Center for Lifestyle Medicine. Welcome back, Dr. Ruan.
Hey, thanks. Appreciate you having me.
Such a pleasure, and I know that we've talked about so many different topics. And one thing that we discussed possibly talking about is a topic near and dear to my heart, which is fertility.
Yeah.
So tell me a little bit about the work you do and some thoughts about fertility.
You know, at the Texas Center for Lifestyle Medicine, a lot of what we do is we get patients to feel safe and open up. Fertility is a very emotional topic, but it doesn't necessarily have to be that way, because I think people, especially women, feel isolated or feel quote unquote less of a woman if they're having fertility problems, but people don't have to feel that way. My wife's an OB/GYN, so we talk about women's health quite a bit, and I have 3 daughters, right? And so the topic of fertility is always, it's sort of a daily topic, to be honest with you, is because the emotionality of it is so complex. And I think we really have to approach it from the fact that for most people with fertility issues, men and women, it didn't start with you. It may have started generations up, like genetics and genetic inheritance and stuff like that. And just because you have the gene doesn't mean you have to express the gene. It means that you can do stuff about it to have less gene expression to improve your chance of fertility. So I like to, put a spin on that concept.
I love that, because when we talk about fertility, so much of the time we hear a lot of the same conversation.
Yeah.
And so I would love to switch it to a little bit of a different conversation. So you're talking about genetics, and I don't think you're actually talking about those genetics that we're looking at for like Down syndrome. You're thinking about different genetics.
I am thinking about different genetics. So Down syndrome is a chromosomal abnormalities, and there's not much that can be done about that. But there's these other type of genetics, which are single nucleotide polymorphisms. That's basically a fancy word of saying variability in different genes and gene expressions. So what happens is, a little biology session here, is that we have DNA, and we have a lot of DNA, we know what it does. Most we don't know what it does. And the part that we don't know what it does is actually more important than the part that we do know what it does. So historically, scientists have called this junk DNA. Because, we don't know what it does, we call it junk, right?
That's right.
Yeah. So now it's no longer called junk DNA. There's other terms for it, and there's a whole sequence called complementary DNA, where we realize that this part of a gene can activate other genes as well, right? And so when you look at genetics, just like the double helix of the DNA that's rotating, is that these sequences have different proteins that attach onto it, so either expresses or it doesn't express, okay? And that's what single nucleotide polymorphisms are, or SNPs, which you can actually get analysis on cheek swabs and stuff like that. That's how a lot of the ancestry companies actually get the information. So people think that I am born with this gene, therefore I am doomed to this. So in the infertility specialist world, there's specific genes that they look at. There's MTHFR, which is a sequence of multiple genes, not just one. There's COMT and all these different letters that put together to describe what it does, what it doesn't do, right? And so we see these genes that are there, and we say that you are high risk for having this, therefore we put you on this medicine, here's some progesterone, here's some aspirin, et cetera, right? But the reality of the situation is there's a lot to do in lifestyle to make sure that these genes function the way that you want it to function, not against you, especially in fertility. And this is called epigenetics. Epi means outside of the actual gene. There's things you can do outside the actual genes. And epigenetics are in the bucket of things you can control, and genetics is in the bucket of things that you cannot control. But my gosh, epigenetics is actually a lot more important. So exercise, diet, lifestyle, sleep, these are things that control the epigenetic expression, so these genes aren't creating this sort of disastrous effect for you.
Can you give us, and I love epigenetics, can you give our audience a very simple example of a gene and something you can do with lifestyle to show epigenetic change?
Yes.
Like a before and after.
Absolutely. My favorite is BDNF, brain-derived neurotrophic factor. I'm a brain guy. That's mostly what I do. And so there's genes that encode for the creation of this BDNF, which actually helps support the brain. attention, memory, et cetera, et cetera. And when BDNF goes up, guess what? Your hormones start going up, your progesterone start going up, your estrogen derivative starts going up, right? And what happens is it creates this huge downstream effect. So what increases BDNF the most? 20 minutes of walking, okay, 3 times a week, dramatically increases BDNF, right? If you're eating a healthier lifestyle, eating things that aren't too inflammatory, create a lot of inflammation, that can improve it as well. If you're hydrating well, that actually improves it as well. So these are things that control the epigenetic expression so that people who are born, like myself, I have copies of these BDNF genes that don't express this, that doesn't allow the creation of BDNF as much. Another one is ApoE4. The person who made this one famous is Chris Hemsworth. In a recent documentary, he talked about, my gosh, I have the Alzheimer's gene, right? Well, the Alzheimer's gene is really the God gene, because people, ancient times, lived longer with this gene because they can create more inflammation. But now it's called the Alzheimer's gene because people ignore inflammation. If you are having joint pain, you take an aspirin, you know, but it doesn't decrease the inflammation in a long period of time. It can actually worsen it, so you ignore it over a long period of time. So some of these genes that whatever we're calling it, like Alzheimer's gene, is really built upon human survival, but we're putting it in a different light. COMT is another one that's associated with breast cancer, mental health disorders, and infertility, right? So this gene, once again, is also part of the warrior's gene. So COMT, the C stands for catecholamine. And catecholamine are what happens when you kind of rev up and you want to fight somebody, the adrenaline pumping, right? So these are catecholamines. So the ability to rev that up a lot means that you are in this warrior mode. And when you're in warrior mode, your fertility comes down and you're trying to survive. So it's that survival mechanism that's there, right? But once again, that served us, our generations past, really well. Mm-hmm. But now it may be contributing to fertility issues. So what do? Mindfulness, meditative practices, right? Seeing psychotherapists. These are all amazing things to do to create that calmness, because when you're actually calm, that gene is not as expressive, so it doesn't become that Achilles heel that you have for fertility as well. But these are just like some of them. There's a lot.
Yeah. So even just I'm gonna grab the first and the last, because
sure.
We'll put ApoE4 aside. I know that's to mention we're talking fertility. So COMT and BDNF. So these are genes that they can be normal warrior genes. So historically they worked for us.
Yes.
They were great because we were out there and we were being warriors. We had to fight.
Yeah.
It was a different fight than it is now. Fight or flight now is not the same. Now it's wake up in the morning and what is my boss going to say to me, and my husband's going to yell at me, and those kinds of things, right? And so now, and we're sedentary. Mm-hmm. And so now what we're looking at with these warrior genes like BDNF, COMT is what can we do to optimize their function, so make them express better in order to optimize basically our hormones and decrease inflammation.
Yeah, which means you have to schedule time to be a warrior. Go boxing.
Schedule time to be a warrior, okay.
So once you schedule time to be a warrior, you're done with, and afterwards you feel pretty dang good, right? So there's a high and there's a low that comes down, right?
Okay.
Like we're made to battle. Like that's how we survive all these years, right? So we want to honor our inheritance and our genetics. Now, for a lot of people listening to this, like, my God, I have no idea what genes I have. Well, you don't really have to know. It's nice to know. You don't have to know. Think about your bloodline, your lineage. I have a friend of mine who's from a Viking heritage, right? And so, these are Viking warriors that are there. And what you see is that he's also sort of has this fight or flight stage, but then at a certain time, it no longer serves him. I have another patient, similar story. I had one of the lowest sperm counts I've ever seen. And then he got treatment for psychotherapy and trauma, and then without doing anything, his sperm count naturally went up. They had a beautiful child. The child is now about 1.5 years old right now, really beautiful, beautiful baby boy. Like we're seeing this on men and women. Infertility is not just a woman thing, it's a men thing as well. In fact, most of the time it's actually in men. And so we really have to understand that there's so much that we can do. So much we can do for fertility.
Oh, that's great. So it looks like with these genes, part of us is warrior, meaning get your body moving, get that exercise,
Yeah.
and part of it is also that relaxation state and
Yes.
getting out of that stress.
Yes. Warriors naturally are really good at de-stressing, but a lot of times the expectations of society on a warrior is quite different now than back in the days, right? Here's what's really interesting. The people with warrior genes tend to go into warrior professions, okay? The military, a lot of people with warrior genes, right? The healthcare professionals, nurses, doctors, a lot of warrior genes that are there. Lawyers, a lot of warrior genes that are there, right? So there's a preferential even profession for people with these genetics as well. And so what we have to understand is that we're just a new type of warriors, but we have to create that space for safety and relaxation, honoring ourselves. I think that's just super important to have that balance, and balance is the key to fertility for both men and women.
Oh, that's wonderful. Thank you so much. What a different angle on fertility for today. I really appreciate that, a true demonstration of the new health.
Yeah, absolutely.
So will you please, Dr. Ruan, tell us a little bit about what you're working on and how people can find you?
Yeah, so what we are working on at Texas Center for Lifestyle Medicine, so texascenterforlifestylemedicine.org, we develop programs where people can come together and actually talk about stuff like this, right? We recently just started a session discussing fertility and planning and stuff like that. And we even invite outside professionals to come in and talk about it. You can find me on Instagram, Cheng Ruan MD. Just search my name, or LinkedIn. I'm on both those platforms quite often.
Thank you so much, Dr. Ruan. It's such a pleasure having you with us here again today.
Thank you.
Thank you so much for joining us for The New Health. Please join us again next week at the same time for the next edition of New Health.
This has been a Now Media Networks feature presentation. All rights reserved.